Okay, so this is a 35-year-old lady who had an injury 6 weeks ago in a gym. Sorry, 4 weeks ago in a gym, and jammed the left little finger into the ground. So you can see clearly what's happened is that she has had an abduction injury and had an avulsion type fracture of the radial collateral ligament as it inserts into the base of the proximal phalanx. So at one stage, this proximal phalanx went all the way across, and now she sustained a fracture. The hard indications to fix this fracture would be if it involves more than 20% of the joint surface, and that's really on the edge, or if it's more than 1 or 2 or 3 millimeters displaced. Now, I'm sure there are many surgeons who might consider fixing this, but we decided to be conservative and not operate on this particular patient. If you look at her hand now, you can see at 4 weeks, she's doing fantastically. Open up and close. She can make a full fist, which I can promise you she would not be able to do if you had operated on her at this stage. And just open up again. And that collateral ligament is stable both in extension and, most importantly, in flexion. A completely static endpoint with no pain whatsoever at 4 weeks. What is interesting, though, is if you look at the X-ray now, you'll see a delayed union at 4 weeks, but this is completely non-tender, and it is in keeping with a typical hand fracture, which takes a while to show callus and complete bony union. So yes, you could argue that there's been displacement of this fracture, but I know from experience that this patient will do fantastically well with a full range of motion, no long-term arthritic problems, and she will likely progress to union. A repeat X-ray will be taken in 6 weeks' time just to confirm union.